think a really good question is when to see a pain management doctor and actually when to stop seeing a pain management doctor. And I think the same question can apply for any specialist in the field of spine, whether it's a physical therapist or a chiropractor, a massage therapist, or anyone that is non-surgical. I think it's really important, number one, that you optimize all non-operative treatment. So there are a lot of chiropractors that I trust. There are a lot of pain management doctors that I trust. There are a lot of therapists that I trust. And I actually rely on that non-operative treatment before I ever consider surgery. But you have to know sometimes when your specialty has optimized and maximized and exhausted the potential to help someone. Each of those specialties have their limits. And what happens sometimes is that the structural integrity of your spine has become so abnormal that no matter how much muscle you build, no matter how much flexibility you've rebuilt, no matter how many injections you've had, narcotics you've taken, no matter how many manipulations you had, which I'm not a fan of in the neck, by the way. But no matter what you've done conservatively, it's not working. And every day is a miserable day. If every day your pain averages a 5 or a 6 or higher, if you have any deficits, which means if you're getting weaker in your arms, you're getting weaker in your legs, if you're losing your balance, if you feel like the dexterity in your hands is lost, if you can't button buttons, if you can't write clearly, if you can't do fine motor skills, if your foot is slapping on the ground or you're tripping over your foot when you walk, or if you just have severe pain in your neck, your mid-back, or your lower back, it's probably time to see a spine surgeon. Now, even a good conservative spine surgeon is going to treat you conservatively. So you can rest assured that a conscientious surgeon doesn't rush everybody to surgery. The vast majority of the people that we see in SA Spine are treated conservatively. That's why in our clinic in San Antonio, we have therapists, we have pain management doctors, we have PAs, we have a neurologist. All of those specialists are there to provide the non-operative treatment that you most likely are going to need. It's only when those things have exhausted all potential of helping you that you then are referred to a surgeon. Even then, sometimes I see patients who have exhausted every conservative measure, and I see them and I figure out, wait a second, have you done this or have you done that? And we realize there's things that they haven't done that are options short of surgery. So I'll send them back to do more injections or a specific kind of injection. I think it's really important when you're in pain. This is my own personal preference. I think it's very important that you go see a spine specialist if your pain is not being adequately relieved. A lot of the pain doctors that I know and really respect know when the pain management measures have exhausted their ability to help, and they'll refer patients to me to see if there's something that I can do structurally to fix the spine. But a lot of pain management doctors don't ever send their patients away. Their goal is to keep you as long as they can. And they'll keep doing injections and they'll keep giving you narcotics and they'll just keep upping the doses. And that's one of the reasons we have an opioid crisis in America. Most pain doctors are conscientious, but you never know. And they sometimes don't know their limits, and they'll keep doing everything they can because they don't want to give up on you. And it could be the best intention in the world, but there are limits to what non-operative specialists can provide. So if you feel like you're not getting better, it's time to see a spine surgeon. That surgeon should be able to identify even which injection would be better. One of the beauties of having a background in orthopedic surgery is when someone comes to me with shoulder pain or arm pain or nerve pain in the hand, my training as an orthopedic surgeon can potentially save them from an unnecessary neck surgery. What does that mean? That means that if you don't understand how the shoulder and the wrist and the elbow and the nerves in the arm work because your specialty is just the brain or your specialty is not orthopedic surgery as a foundation, then what you may see is every time somebody has shoulder pain is it's got to be from the neck. So they need neck surgery. Do you know that 35 to 45-year-olds have about a 35% chance of having arthritis in their neck, even without symptoms? So what happens if you have shoulder pain and you go to a doctor who doesn't know how to work up the shoulder, who doesn't know how to examine the shoulder, who doesn't know how to rule out shoulder problems because they've never been trained to work on the shoulder? What'll happen is they'll get an MRI, they'll see something wrong in your neck, and they'll do a surgery in your neck for a shoulder problem. that's not going to be effective, right? So the same thing applies to the hip. It's very common for pain in the back to radiate to the hip, but it's also common for pain in the hip to radiate to the back. So how do you know the difference? An orthopedic surgeon who has a fellowship in spine surgery can identify both. So what we can do is we do differential injections, which means that if I think it's your shoulder and it could be your neck, I'll inject your shoulder. If the pain goes away, it tells me it's your shoulder, right? I know how to read an MRI of the shoulder. And then what I'll probably do, because I don't do shoulder surgeries anymore, but I know how to do the evaluation and the treatment, is if you need shoulder surgery, I'll send you to a shoulder specialist that I really trust. If it's a neck problem, then I'll handle the neck problem. But the difference is understanding when it's a shoulder problem, when it's a hip problem, when it's an extremity problem versus when it's a spine problem. And that's a very important thing to understand, is that not everyone understands how to do that examination of the extremities. And they might do an operation that's totally ineffective, again, thinking that it's related to your spine.